This is a related video to the video I just shot. This is a video about, do I need to remove skin from the neck when I do a deep neck lift on a younger patient? Is there going to be extra skin? In fact, this is what the gentleman that I did in consultation asked me about, and immediately I thought about I should shoot a video about this. What you're seeing on the screen is, it's unfortunately backwards because I had to flip the image, but this is the, sorry to scare you non-math people out there, but if you remember a squared plus b squared equals c squared, that is the Pythagorean Theorem, which essentially says that the two shorter sides are a squared plus b squared. To get the third side, the hypotenuse, across from the right angle, you need a c squared there. So each side is a plus b, does not equal c, but a squared plus b squared equals c squared. So if you look at that, the 3, 4, 5 triangle is probably the classic example. And so what you're seeing, that hypotenuse is the blunted angle of the neck when it's fat. And then you can also see mine here bulging out here. So this is the hypotenuse. I create a right angle or close to a right angle. And so that takes out, it converts the 5 into a 3 and a 4, for example. I mean, it could be any number. I'm just using it as an example. So what I'm showing you is that 3 plus 4 equals 7. And 7 is more than 5. So the reason I'm mentioning this to you is that because the neck on a hypotenuse, which is what you have, is shorter than the distance created by the right angle, there is no extra skin. Now, that's why for a younger person with good skin elasticity, it shrinks up to that void very, very easily, because you probably heard nature abhors a vacuum. Essentially, that's what happens. It shrinks up and seats up there, and you don't need to take out extra skin. So people think somehow that with all this bulginess, when I remove all of that, there's going to be all this extra loose skin that I've got to remove. And that's certainly not the case, especially for a younger person. Now, for an older person, they've already got skin laxity, so the skin is a big, baggy, saggy balloon. And once I've tightened all the deep structures, that extra skin that's sitting there is now more obvious because all the deep tissues have been tightened, and it's not going to sit up, and you've got to do the lift. And that usual arbitrary break point is around 40. Although for Asians or people with thicker skin with less sun damage, I could do just an isolated neck lift in a person over 40. You got to look at skin elasticity, the age, the ethnicity, a lot of components in terms of deciding whether that skin will go up. But the point of this video is to express that the idea of a squared plus b squared equals c squared is that the distance traveling of skin is actually longer, so there's not going to be extra skin to remove in a younger patient.